Hi guys, as promised, I was going to give you an overview of the HCPCS Level 2 code book. Now I have an older edition because I don't usually use HCPCS. HCPCS tends to be computer generated, which means it's usually in the charge master of your facility if you work at a hospital, and it's that tape that you see the technicians and the nurses tear off, like for example the IV bottles, and they scan the barcode. These HCPCS codes tend to be barcode generated, so they're in the system. But if you happen to be one that's chosen to generate a HCPCS code for your organization, this is the book that you would use. So, as with any book, I always tell you guys, especially your ICD-10 and your CPT, always read the introduction to your book. Your introduction gives you information like crazy. Look how it tells you how to find codes that are only female, male only, okay? They tell you how these codes, what the symbol to look for that lets you know only a female procedure, only a male procedure. So make sure you're reading over your introduction in any of your code books, okay? The next section, of course, is your alphabetic listing or your index. And by looking in the index, looking up whatever you want to look up, it will lead you to the code, just like with your ICD-10 CM book. Now, for example, I was asked to find a code because at that time our facility was not doing a lot of breast implants. So I was asked if I would find a HCPCS code for the breast implant, the actual implant that was being put in the breast, because we didn't have one on file. So the only thing I did was come to this HCPCS book, go to implant, come down to breast, and it's L8600. So when I go to L8600, L8600, implantable breast prosthesis, silicone or equal. And it lets me know, guys, I'm in the right place. That is the code that I would generate for an actual breast implant, the actual material that's put in the breast. Going into my first section, which is the A section, transportation services including ambulance. And notice it says, this code range includes ground and air ambulance. Always read your little paragraphs at the beginning of your categories, your sections, right? Section is a group. So it's telling me there's my group of codes. Read those little introductions at the beginning because it gives you a lot of information about ambulance transportation. And when I think about ambulance transportation, I'm thinking of basic life support or advanced life support. See how that BLS and an ALS, and how they keep track of waiting times by time equals to number of units. It's all in this HCPCS book. Okay? Going right into the next section, enteral and parenteral therapy. Okay? These are your tubings for your nasogastric tubing. That supply. Okay? Outpatient PPS. Look how it says here. Anchor screw for opposing bone to bone or soft tissue to bone. That's the implantable substance or device. And all of these are right in this. Catheters, intracardiac. And then goes right into your E's, which are your durable medical equipment. E codes include durable medical equipment such as canes, crutches, walkers, commodes, decubitus care, bath and toilet aids, hospital beds, oxygen and related respiratory equipment, monitoring equipment, pacemakers, patient life, safety equipment. Again, you ever wondered how they charge you when you go to the emergency room and they send you home with a walker or a crutch? Look at the difference in the crutches. There's a difference in the price too. And they designate them by a HCPCS code. Attachments, commodes. You have G codes. Now I spent a lot of time in G codes. And G codes are used to identify professional health service or healthcare procedures and services that would otherwise be coded in CPT, but for which there are no CPT codes. But I've got an asterisk. Please refer to your CPT book for possible alternate codes. So if there is a code in the CPT book, use that code first. But there are some that just aren't. You're told by certain Medicare to use a G code. Colorectal cancer screening, flexible sigmoidoscopy. Have some more. Colorectal screening, cancer screening. Okay. Those are the G codes. So when you hear about G codes in your coding, you know it comes from a HCPCS. All right. Alcohol and drug abuse treatment services, the H codes. And notice how it says per 15 minutes. Behavioral health counseling and therapy. It's 5 minutes. See how they generate their code? J code's a big one. That's the actual medicine. J codes include drugs that ordinarily cannot be self-administered, chemotherapy, drugs, immunosuppressant drugs, inhalation solutions, and other miscellaneous drugs and solutions. And notice they go down, it talks about the different medications. So this is the medicine that goes in the syringe. But these are the J codes. You do it by the milligram. For example, if that was 1,000 milligrams, because that's 500 and there is no 1,000 milligram code, I do that code, J0207 times 2, to get my 1,000 milligrams. Okay? So these are your J codes. Then it goes right into your temporary codes, your K codes. Path and lab. P codes include chemistry, toxicology, microbiology tests, screenings, pap smears, and various blood products. So again, when you see a pap screen done, cervical or vaginal, up to 3 smears by a technician under the physician's supervision, that's the P code that's used for the actual pap smear that's done. Okay? Temporary Q codes. Temporary national codes. State Medicaid codes. And vision services. The V codes include vision-related supplies, including spectacles, lenses, contact lenses, prostheses, intraocular lenses, and miscellaneous lenses. And look, they're the glasses. So when you go to your eye doctor, they generate a V code. And with any book, guys, I always recommend the appendix, especially in the other code books. Go to those appendix. Those appendix give you a lot of helpful information too. Table of drugs and biologicals, appendix 1. And what it does is it gives you, look up the medication. Let me show you the table at the top. Drug name, units, route, how is it, IV, subcutaneous, and then the actual code for it. So this table is in alphabetical order for the drug, and it's a shortcut to it. But again, this is appendix 1. Appendix 2 is your modifiers that remind you of something. Yes, our code books. There's your modifiers. Appendix 3 is abbreviations and acronyms. It gives you tons of them. Table 4, again, is your publication 100 references. That's on your CMS website. But this book just happens to have them in here. For that time, at that time, what was on the CMS website? 5, Appendix 5, new, changed, deleted, and reinstated HCPCS codes for 2013. Again, this is an old book of mine. So this just tells me if I was looking up a code and couldn't find it, and I can go back here and find out why I don't have that code. It might have been deleted. Appendix 6, place of service and type of service. Pharmacy. Urgent care facility. Inpatient hospital. Okay. Appendix 7, Medicare average payment table for HCPCS. 8, medically unlikely edits, MUEs. You see, it tells you the number of MUEs for the CPT. Okay. Nine is of your deleted codes for that year. 10 is your glossary. It talks about different things. Apnea is the absence of breathing or breath. And then Appendix 11, Physicians Quality Reporting System. PQRS had just come out in 2000, I think about 2013. But again, it gave you the PQRSs. So again, guys, that's an overview of HCPCS. So if you're wondering, if you ever have told to please find a HCPCS code for a supply, this is the book that you'd look for. All right, guys, that's it. Just wanted to share that with you. Thanks.